Hi, my name is Robert Chelle with Chelle Law, and I'm an attorney that assists nurse practitioners with employment contract and independent contractor agreement issues. Today I'm going to talk about nurse practitioner bonus structures. So, what are some of the most common types of bonus structures, some red flags to think about, and then just kind of go through the basics of them. So, first, let's identify the different types of kind of base compensation structures, and then I can get into the bonuses as well. So for nurse practitioners, it could be an hourly rate. Maybe if you're working in urgent care, or you could be doing hospitalist work, ED work. That's kind of a common way of doing it. You could have a straight base salary, which is more common if you're working for a hospital or healthcare network in like a subspecialty, or if you're outpatient. Same thing, primary care, you usually have some kind of base salary. And then if you're in a healthcare network or hospital job, perhaps they have an RVU-based compensation. But the smart practices, and I guess this is my opinion, incentivize their providers to, work harder, see more patients, however you want to explain it. But they're rewarded if they're doing a great job. And so there are different ways of doing that. If you're in private practice, outpatient setting, very likely they're not going to use RVUs. What they're going to use are collections. So meaning whatever the NP, their personally performed services brings into the practice, then the nurse practitioner could get a percentage of that. So that's a model where you could be paid only on your percentage of collections, which is rare for an NP. But in a bonus structure way, let's say you'd have a guaranteed base salary, and then they would come up with a threshold, meaning maybe every month or every quarter, they would say, any money the practice brings in that's above what we paid out to you in your salary, we'll give you 20% of, or something like that. That would be a standard way of doing it. Or they usually wouldn't do that monthly. I'd say quarterly is more common in a scenario like that. So once again, whatever they've paid out to you via your base salary, compare that to whatever was collected. If there's a surplus, then you would get somewhere between, I'd say 15 to 25% would be a normal amount. Now, if you're only compensated on collections, it will be more than that. It should be somewhere between 35 to 40%. All right, so that's the kind of the collections-based productivity model. If you're working in a hospital or healthcare network, they will not use collections, they'll use RVUs. And so in this model, they'll come up with the threshold and they'll say, all right, this is your RVU expectation for the year. And let's say an NP in primary care, and we'll say their RVU expectation is 4,000. So per quarter, they'll say any RVU you generate over 1,000 in the quarter, then you multiply that times what's called a compensation factor, and that can vary. I would say in this scenario, for a bonus for a nurse practitioner, it could be anywhere from $20 to $40. And so if you generated 1,100 in the quarter, then you would just take your 100 RVUs above the threshold, multiply that times, let's just say 40 in the scenario, and then you would receive, whatever the amount was after that. So that's a normal way of doing it for RVU bonuses, is just them putting down a threshold, and then anything if you exceed that, you would get bonused. It would be better if it would be a shorter interval, quarterly versus annually. If you leave a job, many of them will have language in the contract that says you have to be employed at the time the bonus is given. And so if you have to wait an entire year, and then maybe they'll pay it out within 30 to 60 days, you've kind of given up an entire year if you leave before it's paid out. Or if it's a quarterly bonus, then whenever you leave, you at least got probably 3 bonuses throughout the year besides that. So that's one thing you can negotiate, and so that's what I would suggest doing. The last type of bonuses would be encounter-based. This is probably less common, but especially in primary practice, this would be a model that's used where they would say, we expect, I'll just say 25 patients per day. And then any average amount above that. So let's say it's a quarterly bonus based on encounters. And they said, all right, any average patients that you've seen above 25 per day in the quarter, they'll add that up. And so maybe the nurse practitioner averaged 30 patients a day. So 5 every day for an entire month above that. And then you would just multiply that number times, once again, some kind of monetary amount. I would say probably $15 to $20 would be normal as well. And then they would give that out as a quarterly bonus. So those are some nurse practitioner bonus structures. If you have any questions about your compensation model, employment agreement, independent contractor agreement, feel free to contact my law firm at the information listed below in the description. And I appreciate you watching the video. All right, thanks. Bye.